So number two, Dr. Mahoney, what do you think the second thing every parent should know? What's that?
Well, every parent always wants to know how much it's going to cost, but that's really hard to discuss on a worldwide stage because, you know, how long is a piece of string, right? So let's broach the other issue, which is how long will it take?
Yes.
Right? Now,
yeah.
on average, if you're just doing fixed braces to align teeth, you could be looking at about an 18-month treatment plan, right?
Okay.
And in the past, that was the go-to average for everyone. Some cases took 2 years, some took 12 months, but 18 months was a safe figure. Now with modern technology, you can scan the teeth, you can show the parent what the teeth is going to look like, and then your computer can calculate on average how long that movement would take. So now I can give people a more accurate estimate, right? That's when it comes to what we call phase 2. What is phase 2? Phase 2 is straightening the permanent dentition, in other words, when we have all our adult teeth. But phase 1, that is known as dentofacial orthopedics. So what is phase 1? A young child comes in 8 years old, they've got a narrow jaw, they've got a crossbite, we need to expand the palate, right? So the phase 1 treatment is normally under a year. And it's not as though your child is going to start treatment at 7 and then be in treatment right until they're 14. That's what parents don't understand. Normally phase 1 is a less than 1 year interceptive phase to make the jaws the right size, to move the jaws in the right position, to improve the child's breathing, and Sarah, you know, the correct swallowing pattern, establish normal function. And we then normally put the child in a holding pattern, you know, with periodic reviews, maybe 6 month or yearly, just to see how things are going. But we then tend not to do phase 2 until we have eruption of the second molar, which you would know as the 12-year-old molar, because on average it erupts at 12. So I'm advocating 7 to 8, you know, some interceptive treatment, a phase 1. A period to allow natural growth and development to continue not being impeded by habits, etc. And during that time, maybe there's a retainer wall, okay? And then full teeth, let's have a look and see what needs to be done. Now, in my experience, if you do phase 1 really well and you get it at the right time, the time in braces for phase 2 is less than 6 months, if it's needed at all. So I'm still a big advocate that phase 1. But then answer to your question, phase 1, less than a year. Full braces, if you're not doing phase 1, 18 months, right?
Okay.
If you're doing phase 1 and then phase 2, a year of phase 1, probably 6 months of phase 2, but a big gap between the two. Hope that makes sense.
Yeah, that makes perfect sense. So, very good.